Hello everyone, welcome to another episode of Health Tech with Purpose. Today we have Kyle Kiser, CEO of Arrive Health, joining us on our show. Kyle brings a wealth of experience from both the sales and leadership background and has grown various businesses to the next level. Join us on Health Tech with Purpose as Kyle shares his story and insights on how AI would improve patient care.
Hello, everyone. Welcome to another episode of Health Tech with Purpose podcast. Today's guest is Kyle Kiser from Arrive Health. Hi, Kyle. How are you?
Doing great. Glad to be here.
Same here. Pleasure is all us. Thank you so much for joining in. And we are equally excited to know more about your work and about you in the next 30 or so minutes. So, Kyle, why not we start with Arrive Health? Can you tell us more about Arrive Health and what you guys are doing at Arrive Health and so on? Let's
Yeah,
start
happy
from.
to. We're a data network that connects to the point of care. What we mean by the point of care is we are integrating directly into the e-prescribing workflows of providers as they're selecting medications on behalf of patients. So the goal there is to guide to more affordable options for patients, and that might be in better relationship with their insurance plan. That might be uh, considering a cash pay option. That might be suggesting a medication that does not require prior auth instead of one that does require prior auth. But we are kind of demystifying um, that very complicated space of the
Okay.
patient's insurance and how that affects prescribing.
Okay. And does it has to deal with more outpatient or is it inpatient or both?
Outpatient, yeah, ambulatory prescribing primarily.
Okay. Okay. So, quick question, that, again, there are many companies that are trying to, I would say, like decipher or simplify the patient journey. Can you go deeper a bit in how Arrive Health is creating value and, what is the mood that Arrive Health creates? And your customers are usually practices or the patients like B2C themselves?
Sure. To your first question, the moment in time that we influence is really unique and important because it is before the medication's ever been prescribed. It's before the decision is left uh, the healthcare facility. So it's inside the EMR before the medication's signed. We guide that prescribing decision as a part of the decision support capabilities built by that EMR, and help drive the right decision the first time. So if you think about our prescribing processes now, it's a complicated multi-step process in
Mhm.
our healthcare system today. And we are at the very beginning, the outset of that process. So we have the opportunity to resolve it before the order's signed, before the order's routed, before the prior authorization is being considered. All those things can be resolved at the very outset. So that's the most important part of what we're doing, and and we've done that in some interesting ways. So we're taking on this problem by building direct relationships with their health plans and the PBMs that are actually adjudicating that price. So what that allows us to do is have very accurate representations of the patient's out-of-pocket cost inside of those ordering workflows. Because the goal is, if we can get the right decision happening the first time, we can then smooth a lot of processes downstream that are much more complicated and burdensome to providers and payers and patients themselves.
Mhm.
To your second question, business model, it's a multi-sided network. So we work with a lot of different constituents. We work with health plans and PBMs. Those are our customers. In some cases, we work with large provider organizations to help decision support around pharmacy selection. Those are our customers. We work directly with cash pay programs and on behalf of patients and finding cash pay options. So in a multi-sided network, we kind of have a lot of constituents who we would consider customers. I think in addition to that, the provider user is also an extraordinarily important element of what we do and the value we provide, because we have to be solving problems that are important to those providers and doing it in ways that's value add, or otherwise the relationships on the other ends of the network become less valuable. So we think of them all
Mhm.
as a customer in a way, because we have to be solving their problems.
Mhm. So how did Arrive Health happen? Like, what was the inspiration or that moment of epiphany that happened? What brought you guys as a founding team together? Tell us more about that part.
Yeah, so a guy named Kevin O'Brien, still a doctor in Denver. Part of the outset of this business was that Kevin was approached by his mom, who had a out-of-pocket spend that was significant, and she wanted some help with. And Kevin looked at her meds and found ways for her to save on her medication, and took branded med, split it into its generic parts, found a therapeutic equivalent for this one, maybe even a pill split or a different form, solved her problem, and that inspired him to start doing this in his own clinic. So the original effort around this company was really Kevin just doing this inside of the clinic that he was working, not because he was in a value-based care arrangement, not because he was making more money to do it, just because he saw that patients can't manage their conditions if we can't get them on medications that they can afford. And that's really the initial inspiration. So we, from that sort of founding point of view, have now built this business really with a lot of the same focus. We still spend a lot of time thinking about how do we solve problems for providers, and we worked really closely as strategic partners and investors with providers, because that's where the trust is most vivid inside of the healthcare journey for a patient, right? When you have a question about your medications, your instinctive outreach almost every time is to the provider. It's because that's where that decision originated, and more often than not, patients have a lot of trust in their providers. For better or worse, they don't really care to talk to their health plan or the PBM, right? You wake up in the morning, you seek out a conversation with your provider, you tolerate a conversation with your health plan. And so that's really how we've oriented the business, is we've really thought about how do we bring the right information at the right time into that relationship between patient and provider, because that's the most leverage to solve the problem. So today we still think about it that way. We've got relationships with places like Providence and UPMC and University of Colorado Health System, where we develop product, we take new ideas, we collaborate with them on making things better, because they really understand that rubber meets the road moment between patient and provider quite well, and it's been an important part of our story since the very beginning.
And what's the way the interaction with the patients happens? So it's a mobile application, it's a web platform. Is it like part of the integration of the provider's platform? So like how has been the usual way of customer, using Arrive Health?
We integrate directly with the electronic health record systems that the providers use. So we're an API that connects into their systems that powers what's called real-time benefit. So now CMS requires a real-time benefit tool for Part D plans, and we are one of those. So we're providing real-time, patient-specific, moment-in-time specific pricing into those e-prescribing workflows. So we're a data network in the background. The user experience and the user interface is all driven by the EMR, and we're powering that element of the EMR.
Okay, great. So, moving forward, Kyle, would like to know more about, how the whole industry, has been moving forward, especially with the advent of AI. And is AI on your roadmap, and is it disrupting the patient care space that you are operating in, and how?
Yeah, no, we are spending a lot of time thinking about how AI is going to be a value add to our network. We have, over the last year, built prior auth capabilities. Those are also directly integrated into the electronic health record systems, and AI is going to be a really important part of that story. And we really think of it as a guidance system opportunity. So how do we collect the right information from our network of constituents and bring that to the fingertips of the provider in a way that helps them make a better decision faster? And instead of what happens today, which is a lot of basically yes or no questions about whether or not their decision is appropriate. And so that's the way we want to reorient things, is let's bring the answers to the provider. Let's help guide that decision from the outset and get the right patients to the right meds the first time, rather than the relatively burdensome system today, which is to go through the processes with multiple constituents that all have some relatively manual way of dealing with it. We see a huge opportunity to automate that from the very beginning of the process.
Right. So are there any use cases you already have in action currently, as part of Arrive Health, or you are like building out those use cases that you just mentioned.
Yeah, the ones I've just mentioned are in stream right now. So these are things
Okay.
we're actively working on and
Mhm.
going to release in some pretty focused ways.
Okay, great, great. And since Kyle, you have spent so much um, of your life into the patient care space. So it would be very interesting to know more from you. Like, how do you see this whole uh, patient care space evolving in terms of what are some of the great solutions that you admire? If you could just give examples or tell about them, and then what are still those big gaps that exist in the market or evolving needs that still need to be catered by if someone is operating or plans to be in the patient care space.
Sure. Yeah, I think the most important thing that's happening is empowering patients with their own data.
Mhm.
And I think that the applications of that concept are going to spider out across the industry in a bunch of ways that are super important and valuable. From our perspective, we think about it as the right for patients to understand their own options, right? And when we adopted e-prescribing the first time around, uh, it was the first time in my understanding of our economy where we adopted a technology and consumer choice was constrained.
Hmm.
We went from taking a paper script if you felt so inclined to any pharmacy you wanted and figuring out how much it cost and getting a good deal to it being routed directly from the EMR system directly to a pharmacy. And so someone else was making a purchasing decision on your behalf. Neither of you knew what it cost until you're asked to pay for it at some third party at some later date. And when you say it in those terms, it just doesn't make any sense. And so I think that part of what is in front of us because of 21st century cures and because of the price transparency rules, because of things like real-time benefit, because of data liquidity in general, are the opportunities to really empower consumers with those types of decisions to reintroduce consumer choice, both at the point of care and throughout the patient experience. It's one of those things that just has to be at the forefront of where we're going as an industry. And because, in a world where deductibles were in the hundreds of dollars and copays were in fives of tens of dollars, it's not that it wasn't super important. It still mattered a little, but it didn't matter that much. Well, today, deductibles are in the thousands of dollars, and that's the norm, not the exception. Patient out-of-pocket expense for medications and all other things are hundreds and thousands of dollars, and in some cases even north of that. And we really can't separate the concept of.
This episode of Health Tech with Purpose podcast is brought to you by MindBowser, a product engineering and digital transformation company focused on health. At MindBowser, we enable health companies to build the future of health where accessible, equitable, and patient care.
We strongly believe that technology can empower a healthier world, and that's why we are partnering with healthcare experts like yours to make it happen.
Hi guys, thanks for listening to Health Tech with Purpose. Make sure to subscribe us on Spotify, Apple, and YouTube for more expert insights on industry innovation and transformation. And remember, share the knowledge.
Consumer choice and insurance benefits anymore. Those have to be increasingly integrated concepts. We got to be able to help patients make better decisions. Sometimes that's going to include their benefits, and sometimes it's not.
Right.
And to me, that all of the unlock for all of that is really consumers now having the ability to demand their data. Is that information blocking is now illegal. There's a chance for patients to really get services and capabilities in their hands and at their fingertips that can help them make better decisions. And that's going to have a huge and important impact on the industry overall. But most importantly, as a healthcare consumer, the consequences of you not being able to afford your medication are pretty high. Having to choose between managing your condition through medications or putting food on the table is literally the choice a lot of Americans are having to make. And
Right.
to me, the data liquidity and patients being empowered with this information at the right time to make a better decision is the most important thing that we can be thinking about.
Mhm. And glad that you said that. So, what I would like to know more about, Kyle, would be like, what's your favorite story of impact? Like you mentioned, you touched upon some high level things that you guys are doing,
Yeah,
but what's your favorite go-to story, of Arrive Health creating an impact, and
absolutely.
what it was and how it happened?
Yeah, we've got kind of a super user at Presbyterian, New Mexico,
Mhm.
and he told us this story. And uh, he had a patient in front of him that was facing uh, an albuterol prescription. Albuterol is a generic inhaled steroid. In most cases, when you're prescribing a generic, you think it's a relatively low cost med. You think it's going to be a pretty simple process. And what he had in front of him was a couple $100 out of pocket expense for a mom who was trying to take care of her kid. Um, and he was able to use our tool to say, well, it's not this drug form, it's not this one, so maybe it's the disc instead of the inhaler. He solved the problem. And the truth of it was there was a $0 option for that patient. And he was able to understand where that was, use the tool easily to solve that mother's problem, and do that in an instant. Do it at the point of care. Do it not with her having to go to the pharmacy and figure it out. Not with her having to be told no or a claims denial at some point in the process. It just happened, and that's exactly what we're striving for. You think about if you really put yourself in your parent mindset. I've got two young kids. And think about that day, right? If you're having to more than likely not be at work, you're already stressed because of that. You've got a sick kid in front of you. The way it would work without us is you're standing at the pharmacy counter with a kid that's suffering, probably coughing on you, and the poor pharmacist has to tell you no, or has to tell you a price that you can't afford, and you have to walk out of there with nothing.
Right.
Instead of that, we were able to solve her problem the first time, save her that stress and frustration that would have occurred, and get her kid on a medication that's going to make them heal, going to make them healthier. And that scenario is exactly what we're striving for at every point. We did a little bit of data work last year and wrote a paper on this, that almost half of the time there was a $0 option available when a medication
Wow.
was prescribed that was $50 or more. And that's just an information availability problem, right? It's not that the formulary was designed in a way that's cruel to patients, and it's not that patients or providers don't want to make the right decision for patients. It's that we're not in an effective way putting the information in front of providers to help them make the better decision, and that's ultimately what we're about. That's the problem we're going to solve, and we're going to continue to solve.
Right. And I have a question around that. So what's the incentive for the provider to be good, or say by that definition, not be good? So is it just a choice between being honest and go for profit versus go for profit? Or, there are some patterns that you've seen, with more embracement of Arrive Health tools and lesser in some spaces. So are there any typical tipping points between that, like between people or institutions embracing Arrival and those that are not Arrival or similar systems, I would say?
Sure. Yeah, no, I think to your first question, this is definitely not about providers not wanting to make the right decisions for patients or having some profit motive that prevents them from doing so. Think about a typical clinical day. If you're seeing 30 or 40 patients in a typical clinical day, in the US, there's, in your market, probably a dozen or more different health plans with different plan designs.
Right.
Right? So you take those 40 patients with some unknown mix of those more than a dozen health plans. And those health plans all have different preferences around the way they've negotiated to lower prices for their policyholders. And so the albuterol example, right, that it might be an inhaler for one, it might be a disc for another, it might be nebulized for the other, as some, generic example. And that is true for almost every drug category. There's some complex, at least drug categories where there's competition, is that the health plan has tried to negotiate a good deal for their members, and that creates a right answer, and that right answer may not be the same answer for the next health plan or the next health plan or the next health plan. So it's a machine problem to solve, right? This is just not something that anybody, even the best and most
Can
well-meaning
comprehend.
provider, can solve, right? It's just we this is a very ideal problem for us to create this network to solve. So we, it's absolutely not like a, you know, perverse motivation on behalf of anybody in the supply chain. Honestly, it's everybody's trying to do the right thing based on their constituents and the incentives in front of them. We're just trying to organize that information in a way that helps the right decision happen the first time.
Mm-hmm. Makes sense. Makes sense.
Yeah.
True. Very interesting. So, Kyle, maybe I'd like to touch a bit more on about your background. So, I was reading that you started your career pretty much as a salesperson, and you've grown through the ranks. Your career pretty much, growing with companies and growing the companies. So, tell us more about from being a salesperson to becoming a CEO. What have been your best lessons that have made your life or your journey successful that you could pass on?
Sure. Yeah. To me, the best salespeople are problem solvers. It is taking a really intentional effort to understand the problems that are in front of whoever it is you'd like to sell something to, understanding what they're up against, what they're trying to accomplish, what they're trying to solve, and then coming alongside them to do that. And if your solution is an important application in that process, great. And if it's not, tell them. And it's, being a problem solver and having a high ethic and really earning trust in a way that is authentic and is empathetic of what it is that they're going through and trying to accomplish. In my experience, is what really successful salespeople look like. That's been true in our organization, and I think that's true in a lot of organizations. So to me, those are skills that apply no matter job function, right? They're just applied in slightly different ways. And so in this seat, it's not that different. It's just trying to understand what people are trying to accomplish, what's preventing them from accomplishing that, and then how can I apply whatever leverage I have based on my background, experience, or position to help them do it. I mean, that's the almost a one-to-one overlap from a personal skill standpoint from my perspective.
Right, right. No, I agree. I agree. I mean, though you made it very simple, as you said, but I think that's a very important and like immaculate skill that is required of any salesperson. Be a good listener and be able to comprehend the problems that sometimes your customer also may not be seeing, and then be able to connect the dots for them because you've been listening well and be able to connect it with outside information that you could be knowing possibly.
Yeah, I think you're right. The other thing that's coming to mind as you share that is that another important skill of someone in a sales role is getting all the right people in the room. And so as you're marching through a sales process, you're going to require some technical expertise to solve that problem, probably some maybe clinical expertise in our world, data expertise in our world, and getting that right collection of people into that sales conversation in a way that is value add. Really important skill set. Similar application in my new chair. It's having the right folks on the leadership team, having the right folks and in the company, and empowering them to go do what they do well and kind of staying out of the way, right? And not necessarily trying to dictate every behavior in the organization, but hiring really talented, smart people that are operating at the top of their license and letting them do it is something I see is very similar in both of those scenarios too.
Right, right. True that. So the last question that I'd like to know from you, Kyle, would be, I read this survey from you guys, like 5 reasons to prioritize prescription price transparency. I would like you to comprehend some of the findings from that survey.
I mean, I think we've talked about a lot of this from the beginning, right? There's a lot of downstream waste that happens because we aren't getting the decision right the first time. So goal one is how do we empower providers with high quality information that's reliable, that works nearly every time, and is value add in that provider's workflow. So that's one big element that I think applies in a bunch of different ways to that document. Secondary to that is increasingly we're thinking about how do we leverage our network and our capabilities to not just get the decision right the first time, but how do we help that patient get on med as quickly as possible. That means working with the care team, resolving prior authorizations, and creating the same kind of connectivity for a different purpose to help patients actually get on the medication. And then finally, it's having the ability to follow that all the way through to adherence and ensuring that we're getting the right med the first time. We're helping the patient actually get the med, and then we're making sure that they actually take the med. Because ultimately, that continuum is the only way that we get the value out of that decision, and the only way we help patient health. And so, to me, that's why it's important end to end. Is that all those things have to happen in concert and have to happen in a successful way for
Right.
this value to be as significant as it can be. So to me, that's what we spend our life on.
Right, right. And I think it creates value by saving the waste for everybody. That's how I see it. Like, like there are, just like you said, there are these options and information available, but if you're not accessing it, it's just getting wasted. So it's all about
Right.
creating value from, what already lies, but probably skips the eye. So, or skips the time or the attention.
Exactly right. That's right.
Yeah. Well, thank you so much, Kyle. It's been a pleasure speaking on this podcast today, and we wish you good luck with the vision that you have, and hopefully, Arrive Health helps more and more patients be able to make the right decisions and be able to get a value from their healthcare. Thank you so much.
Thank you for the invitation. Enjoy the conversation.
Yes.
Thank you for joining us on the Health Tech with Purpose podcast. Before you leave, make sure to like and subscribe on Spotify, Apple, and YouTube. And if you would like to see someone on this podcast, do refer to us. My contact details are in the description. Before I leave, I wish you stay healthy, stay curious, and keep building.